Hello and welcome to another episode of Big Thoughts, Little Talks. Nikhil is a good friend of mine from college and currently a fourth-year medical student at UCSF, recently returning after taking a year of leave to focus on mental health and explore his interests. In this episode, we talk about how he spent the last year to gain perspective outside of medical school, touch on burnout and mental health, and also get a glimpse of what the atmosphere is like in the hospitals and healthcare systems in San Francisco during this pandemic. Without further ado, I hope you enjoy this conversation with Nikhil. Welcome, Nikhil. Thanks for joining me on the podcast.
Yeah, thanks for having me, Peter. It's great to see you after so long.
Yeah, I think the last time we talked or hung out was over a year ago, and that was just about when you were starting your year off from medical school. So I'm curious to hear a lot more about that. But I guess for listeners who don't know, could you give a little bit background of like what that time was like?
Yeah. So, um, I assume most people who watch this have no idea who I am or what I'm doing, but yeah, I was a med student here at UCSF, and like for so many people, like from the outside, I think just like med school is the dream. Yeah. I mean, I think everyone knows like pre-med in college sucks, and like everyone has a pre-med friend that just like hated their life in organic chemistry or just like struggling in the MCAT and all this stuff. But then UCSF in medical school, it's supposed to be just the bee's knees, and there were some great parts about it. But the funny thing is just being going through that process of med school, and just kind of realizing that it wasn't exactly what I expected it to be in some ways, and also just life happened, like relationships and breakups happen, and you lose loved ones, and you get sick, and
Yeah.
mental illness, you know, just hits you hard. And so for me, um, it was kind of a combination of all those things where I was super happy to be back in the Bay Area after 4 years in Philly and a year over in India, and nice to be close to my family who lives in the Bay Area. But as I was going through med school, just life happened. A bunch of stuff came up, and my physical and mental health just like took a hit. Um, and as much as I kind of tried to keep telling myself, like, come on, man, you're at the dream school, you're at UCSF, you're gonna be a doctor, like, come on, you got nothing to complain about, just focus on that. Um, I think the more and more I said that, the more and more I just kind of realized like I couldn't do it. Um, and I think for those not in med school, um, I still think people can relate. Like burnout is a reality for people in so much work, particularly right now during COVID. But it's kind of this unique flavor for people in medicine. So you kind of go from being just like this average Joe, like I didn't know. I mean, didn't know much about medicine. Then I came to medical school, and then all of a sudden I'm like, here's a white coat, like you're part of the team, kind
Yeah.
of. So like you can kind of help, but not really. But you feel this sense of responsibility to take care of patients and to like be there like 80, 90 hours a week. Um, and yet you just like don't know anything. You're always at the bottom of the totem pole. Um, but for me, yeah, it was just really hard kind of working through depression while working a ton of hours, and seeing pretty traumatic stuff. I think that's one thing that I think just isn't talked about a lot. Like we kind of hear about it, and we're like, oh, it must be hard. But
Hmm.
it was really hard for me going into medicine because I don't know, thought that I was an empathetic person and wanted to help people, and realizing that there's so many people suffering that I can't help. I can't. So often, a lot of these ailments and diseases were ones that were totally determined by someone's either socioeconomic status, race, gender, um, and how can I change that? But I feel
Yeah.
responsible because that's my job right now.
Yeah.
I'm like, you're
Isn't
a
there a name for that?
physician.
Like a lot of these healthcare workers, they know the treatment that people need to have. They know that they could help them, but they just don't have enough beds. And there's this like extreme like helplessness and guilt. Um,
Yeah, we call it moral injury is the fancy term for it,
oh
but
yeah, that's it.
um, you know, but I think it extends to um, other places as well. I just think I think social workers and even non-clinical workers um, experience this actually probably even more than we do in healthcare, where we can kind of distract ourselves with the sodiums and the calcium levels of a patient. But anyways, I think going through this all as a 24, 25-year-old while in San Francisco, and half of my friends are, making 150K and, have no debt and traveling on their unlimited PTO. And of course, the grass is greener, for sure, as I've learned. But I think at the time I was just like, being like, did I make the right decision? Like, why am I doing this? Like I want to like have fun. Like I want to be able to like go to my cousin's wedding, like instead of working on call.
Yeah, especially in San
Like
Francisco. I feel like that, like going to medical school in San Francisco, you're really surrounded by like that stereotypical tech lifestyle and the unlimited PTO and perks and stuff like that. So yeah, how did you manage to like what did you do for yourself? Like how did you kind of work through that period of your time, period of life?
Yeah, I think a big thing was like acknowledging this growing feeling inside of me of just like I need a break. I need to take a step back. And it's funny how often I think we are kind of conditioned not to listen to that. Um, I think there's so many pieces, part of it just being in like super elite competitive environments. And it's just like, I mean, you know how it is. We went to Penn and it was just like Penn face and keep pushing and all that stuff. But I also think there's this component of coming from Asian American families, and my parents always had it harder. My parents were immigrants, and who
Yep.
am I to complain? And why do I need to take a break? And there's so many layers to it. But I think the biggest and best thing I ever did for myself was just say like, that's it. I need a break, and to tell everyone like, I'm sorry, but I'm not going to be doing this every moment of every day. And that was kind of the decision to take a gap year for me. It definitely wasn't this strategic, like, I need to get into the top neurosurgical program. So I need this litter. I was just like, I'm done. Like, I'm going to take a year off, and we'll see where we're at.
Yeah.
Yeah.
Yeah. So what was the result of the gap year? Like where are you at now and how do you feel? How are you doing?
Dude, I mean, I'll start with saying I feel tremendously better. I feel like a different person than I did a year ago. And I feel like I grew more in the last year than I think in some ways than I did for all of medical school before that. Um, and I think that's one thing that was funny that I realized that like when you're in whether it's medical school, I had friends who did this in investment banking or consulting or whatever it was. You're in this really intensive experience. You are growing in a lot of ways. I was learning a lot of medical knowledge, but I was also not growing in a lot of other ways. And I realized in this year off, I got to challenge myself in so many different ways. I think a lot of people see a gap year or a change in career or like this reflective period as a break. And I really hate using that term because I really think that it's not like you're running on this treadmill and you just pause the treadmill for a year. When you take a gap year or you take a step back, it's actually a ton of work. Um, where not just reflecting work on like what am I doing, where am I going, but also just like finding different things and changing the way that you do things. I think for some people, working 70 hours a week is in a structured environment is easier than working solo on their own project for like 40 hours a week. It's just different for them and it challenges them in different ways. So for my
Mhm.
gap year, I really wanted to figure out, is the grass really greener? Like I have this bucket list of, stuff of shit I always wanted to do. And I'm sorry if I might swear a little. I should probably
No, this
find
is
out if that was kosher.
profanity is allowed on this podcast.
Okay, cool. So now, we're going to PG-13 and above.
Yeah.
Um, um it I kind of was like, there's all these things I want to do with my life and I want to try and test out, and this is my chance, because after this it's going to be a lot harder. You start residency, and that's a whole nother beast, that I could we can talk about later, but as I apply for that. But honestly, what I did, my first thing for that year off was like, I am just going to do what I want to do for this year off, and I have that luxury, I have that
Mhm.
privilege. That's a huge thing I want to touch on, is like I had that privilege to do that. because I wasn't completely swamped with loans. I had a supportive family. I was in a safe place. A lot of my peers didn't have that, but I took advantage of that. And one thing that I knew I wanted to do was um, really take care of my mental and physical health. So that meant going to therapy, that meant exercising every day, which were just things I couldn't do while in medical school, which was great. I signed up to I just started looking for random odd end jobs. So
Mhm.
I really liked biking, and I traveled in Europe for a couple months at the first part of the gap year, which was awesome, by the way. And I took all these bike tours. I thought they were really fun. So I came back and I was like, why don't I guess maybe I'll try to be a bike tour guide. And
It's
so
like
I
Blazing
applied.
Saddles.
Yeah, basically.
Yeah.
Well, it's funny. I was at the competitor of Blazing Saddles.
Oh, okay.
Um,
Okay. Sorry for yeah.
yeah,
I'm only
yeah,
familiar with that the Blazing Saddles franchise.
exactly. Can't help them get any more business because of this. Um, but no, I applied, and when I say I applied, I literally just emailed them and was like, "Hey, do you need any bike tour guides?" They're like, "Great. Here's minimum wage. Will you do it?" And I was like, "Cool." So it really wasn't that competitive of a process, but it was great. And I started taking people on tours of the Golden Gate Bridge from Fisherman's Wharf to Sausalito, um,
That's awesome.
which was
Do you not need any? Did you
sweet.
have to go through like some audition for that? Like, do you need to? I mean, you need a bike, obviously. I assume they tested
You
that
don't
out.
even need a bike. They'll give you a bike. Like, and they'll give you like a crappy bike. Like, not even give you, like, you use their like broken bikes that they don't give the customers. Like, they're like, here's your bike. Here's a vest that's like reflective.
Yeah.
Go. Like, just go. Here's a packet of information that like maybe you want to talk about, but like just go for it. There's really
You
not.
just make up shit as you go. Just like, yeah, this is the Golden Gate Bridge. It used to be golden. Uh,
Exactly. Yeah, just like, yeah, I could just make up whatever. It's 2,000 meters. Yeah, totally. Like, no one's gonna, I mean, unfortunately, people can Google it, but
yeah, but
I mean,
that's
to be
awesome. I
perfectly
mean,
honest, it was awesome. It was awesome.
yeah,
Yeah,
um, yeah. That's I like what you meant. What you said with the like, it's not really taking a break. It's like it's not like hitting stop on the treadmill. Or maybe it is, but like you're just getting onto a different machine, right? Like it's like working out different muscles and like
that's a good
expanding
way
your
of putting it.
perspective. And honestly, like I don't think like I think the like one of the reasons I really like admire you even through from college was that you had that like entrepreneurial mindset. Like we really connected over. Like I remember you started like this venture around photography and kids with disabilities at Penn, and I just like love that like you had this like mentality of trying to help people and like do something new and challenge assumptions and uh, yeah, honestly, like for me, like I remember I was almost going to medical school, and that was one of like my concerns of like I don't know if this is like I'm curious what it would be like to have that sort of drive that I saw in you. Um, and like it seems like you really like turn the obstacle into an opportunity and like the way that uh, I would kind of expect from you. So that's really awesome.
Thanks, man. No, I appreciate it. I think it is cool how we both were kind of had this similar feelings of entrepreneurship, interest in health, and obviously just like you're super bright and realize that there's more opportunities out
You're just
there.
talking about
And
my
I think
lighting,
I
right?
took that.
Here.
Yes.
It is good lighting.
I think, yeah, that's what it was. No, I think I took the more vanilla approach, and I always appreciated that you always, you crafted a different path, and um, but in some ways, I think I almost advise people that have that entrepreneurial spirit to think twice about medicine. Medicine is not very kind to creatives. Um, I'm sure people will disagree with me, but I feel pretty strongly about that. That throughout medical school, my creative side, my entrepreneurial side was not nurtured, at least so far. And from what I know, it won't be for a while. Um, there's a very narrow range of what is considered acceptable in terms of thinking outside the box. Ironically, we say in science, you need to think outside the box. That's how we have new innovations and advancements. But really, that's only within the lens of research, that to basic science research, maybe clinical research. Um, And when we say innovate, we really say read the literature on everything that's been done before and just change it, tweak it like, 0.01%, and then maybe you'll get a grant, and if that's something really special, then we'll publish it. Otherwise, God forbid you have results that are not conclusive, then it's a waste of your entire time. And so it's kind of an interesting scenario that I've learned, and that's changing. That's really changing recently, but overwhelmingly, that's kind of what is rewarded throughout the process. But I think I think taking this gap year was great because I got to nurture that entrepreneurial spirit. I mean, not in the tour guides, that was definitely not entrepreneurial, but in all
That
the
was really
various
the
other side
pinnacle of your
hustles.
creativity. And
Exactly, exactly. Well, making up random stupid shit about the Golden Gate Bridge.
so I'm curious, like, what else during this gap year? Like you mentioned, the testing out the experiment of is the grass really greener, and like what other experiments did you take during this gap year for yourself, and what were your conclusions from that?
Yeah, so one of the other big experiments was I realized I never had a boss. Like I know that sounds dumb, but I'm like 27 now, and I was like, I've had professors, I've had teachers, I've had PIs, which any researcher will know, is kind of a boss, a postdoc, grad student, but I'd never had a boss, and it was kind of dumb because I was like in clinic in my third year, patients would come in for Kaiser Family Medicine and be like super stressed, talking about depression, anxiety, and I'd be like, "Oh, what's going on?" They'd be like, "Yeah, my boss is really on my ass, this, that." And I would nod as if I understood, and I think I could, sympathize. But it was
Mhm.
just like funny to me that I was like, I've just been a student my entire life, and I realized that you don't need to have a asshole boss to be able to understand what that might be like. But I just realized I just kind of set this path of just like this is what I'm going to do now. So I'd always wanted to work at a company. I'd always wanted to know whether that would be interesting, um, and so I started applying for jobs at tons of companies, tech companies, mostly in the healthcare space, but even outside, anything from general consulting to um, you know pretty like mechanical engineering type stuff, which I kind of remembered from my days in college.
Mhm.
Mostly just throwing shit out there and seeing what stuck. And I was really lucky that after like 100 rejections, literally, um, I somehow got this design consulting company called Frog Design to hire me as a healthcare designer. So I was part time. It's funny because I haven't even mentioned my full time job this whole year, which was being a research fellow, which is I think which was fun, but as I think probably the least exciting part of the year. It was really cool, like interesting work, but I think not as exciting as these side gigs I was doing as a bike tour guide and a healthcare designer. But working at Frog Design, was a really interesting experience. I was an employee.
Mhm.
I went to the all hands meetings. All this stuff that people all know what that is, and I was like, in medical school, you literally be like, "What's an all hands meeting?" Like,
Yeah.
like I don't get it. What's a happy hour? Like, we don't have company happy hours. Like, I know it's dumb, but it was just like this place was so typical too. They had a ping pong table. Like it was just like so
Fridge was the
classic.
fridge stocked in harmless coconut water and
Dude, LaCroix. I had so much
LaCroix.
LaCroix. I didn't even know what that was like to have free LaCroix at your disposal, and I took advantage of it.
Dude, that
But
stuff is I mean, maybe not within a year, but it's amazing how quickly like I got used to these things. Like when I applied to my current company, they had this harmless coconut water that was like it was like I just like that was like my fantasy of a startup. It's like this like pink expensive coconut water. I was like, oh my god, if I join this company, I'm gonna drink this, drink like 4 bottles a day. Like literally for the last like year, I just like never drank any of it because I was just like I just had water, I just like filled my water bottle up at the water filter. It's like these things, they're so exciting, uh, like in the beginning, but you get used to them, take them for granted. Anyways,
exactly, yeah,
that's my beverage story. So Lacroix,
yeah,
as you
brilliant.
were.
Yeah, no, LaCroix was cool, but it was also just really interesting to like work at that company, and I was the only person with anything clinical in the room. So anytime they talked about anything medical, they're like, "Nikhil, what's your take on this?" And I'm like, do they know I'm not even a doctor yet? Like, you know, like they're just like, Nikhil, explain to us Medicare and Medicaid. I'm like, I like kind of know what that is, but I'm going to pretend that I know everything about that because that's why you hired
I mean,
me.
you were wearing your white
Um,
coat to work every day, obviously, right? Just to
exactly, exactly. I just brought my stethoscope in sometimes to look really legit, you know, like just sometimes like anyone need a checkup, you know, like I was like, you know, it was clearly like not, yeah, it was funny, but but I'll be honest, it was an amazing experience because I finally had context for a lot of things. I got to do a bunch of cool stuff, um, you know, understanding how design works. They take such a creative approach to solving problems, and I think fundamentally one of the big takeaways I got was, you know, capital is king. You know, like this is a company, they get hired to create a product or develop a service, and they have 6 weeks to do it, and they have a team that's paid to do that, and that might be to the tune of $1 million contract. Whereas in academia, we're usually fighting for grants, we're on shoestring budgets, we're one person doing the work of three. um, and unfortunately, there's not always the accountability or the timeline. So it's really hard to iterate and innovate in academia, whereas in private sector, if you don't innovate, you're going to lose. You're going to be, you know, it's a kind of, it's a survival of the fittest, right? And so it was great because I got to learn very quickly, but I was also expected to, you know, to kind of deliver pretty quickly, which I enjoyed, and was a fun experience. But ultimately, not not as gratifying as kind of healthcare was.
yeah, yeah. So what is was it like always intended to be 1 year and then like coming back, or was that like sort of another decision that you had to make with your new perspective and from the gap here?
Yeah, it was a decision to make. I honestly, when I left, it wasn't the greatest of terms. You know, the best way to liken it is kind of you're in this long term relationship with someone, and you know it started out all great, and then a few years in, you're starting to find yourself miserable, and then you end on a break. You know, this fight.
Hmm.
That's kind of how what I did with med school, where I just ended on this fight where I was just like, I can't anymore. You know, like I feel abused and I feel taken advantage of, and I'm exhausted, and I was like, I need space, and we'll date other people, and we'll see where we're at in a year, you know, or we'll see. That's kind of, I mean, that's the only way I can explain it in terms that I think are, you know, normal.
No, that makes a lot of
Um,
sense. Yeah.
and so that's kind of what, yeah, that's kind of what being at Prague and, you know, doing this research fellow work, um, that we, you know, that I could talk about later. It was just kind of seeing what's out there. I mean, what is this world? I'm too young to just be like, this is it and no other choices, and you know. And so as I worked at Frog and all this work, I honestly I loved it. I was treated really well. I still remember my first day at Frog as a consultant. I went in, and one of my colleagues, her name was Fran, wanted to get my advice on this amazing project she was working on, redesigning the speculum, uh, and which is used during pelvic exams, um, for folks with vaginas.
Thanks for
And
clarifying. I did not know what that was. So
sorry, yeah, if I ever use some terminology that I like forget to explain, remind me. But so she was, you know, she wanted some information, and this was day one. You know, she didn't even know me, and but she's like, oh, you know, I know you're a healthcare worker. You know, could I get your advice? And you know, we were just talking through things, and I'll never forget, she actually wrote down notes as I was speaking. And I know this seems like so ridiculous, but to like anyone else, but I had never had someone write down notes while I was talking. Like no one had deemed my insights so valuable as to write them down in like definitely never in medical school. You know, like in medical school, like you're the bottom of the totem pole. And so like anything you say, like anything you say about patient care, you're like, oh, this patient should get treated with this antibiotic. The like three people above you have already thought of that like a week ago, you know. And so but this was amazing. I was like, wow, you really value your insights. She's like, yeah, this is valuable. Like, and so that made me feel really good. It made me feel really valued. um, I think though, as I was going, I'm thinking, you know, do I want to go back? Do I not want to go back? It felt great to be paid. It felt great to have a work-life balance. You know, people there worked hard but took care of themselves and made sure that if I needed to take care of myself, they let me do that, um, which was really valuable. But it wasn't actually funny enough until COVID. So I was there working on a project, I think, in March or so when COVID was just happening, and one of my roommates was still in medical school, and he was working in the ICU during mid March kind of quarantine time, and I remember it was a Thursday night, and I was getting ready for a client call in the morning, and he just came back at 9 p.m. after a rough 14, 15 hour day, and I was asking him how it was, and he's like, yeah, it's really hard right now. People are getting admitted with COVID. Things are rough out there. And, he was talking about a tough patient. And I remember I got pinged from, a manager just saying, hey, do you think we should do 42 slides of 43? And in that moment, I was kind of struck by this juxtaposition of, what do you want to be doing on a Thursday night at 9 p.m.? Because you're going to have to work hard no matter what you're doing. But I started to realize like the thing that would keep me going, Thursday night at 9 p.m. was being in the hospital and caring for people,
Yeah.
um, not necessarily kind of working on a client deliverable, which was important, but just not what kept me going. That was a real moment of clarity for me. I think that I was like, I think I want to go back and
Yeah.
finish this.
Yeah. I think that this, this sort of time, this sort of crisis sort of brings out different things in different people. But I think, um, even when I think about it, it's like the call to action in some ways, right? Like there's this huge, like this big impact, like right now, like the frontline workers are like the entire world is essentially resting on you all, right? It's like it's a huge burden, but it's also this, I can see how that can be super motivating. Like this is the work that needs to be done. So I guess in San Francisco, I've been kind of keeping up with the numbers, of COVID, and you kind of hear a little bit here and there about the reports, but I don't really know much about what's going on like behind the scenes. So, yeah, what has life been like in a hospital in COVID, either from your own experience or your friends and coworkers?
Yeah. Um, yeah. It's been tough. I always like to, I mean, I have to preface it and say I was kind of out of the hospital. I was lucky enough to be out of the hospital until pretty recently because I was still on my gap year, um, doing, doing research. And, and so I didn't have that same acute experience that I think so many of my colleagues and friends and professors did. But I did, I was in and out in April or in May a bit, and then pretty full time over the last couple of weeks. Um, and what I can say in particular is San Francisco, so California did a great job at the beginning of all this in terms of getting out ahead. Maybe a great job is going too far. We did a good enough job that we didn't feel a surge in health in in the hospitalizations and ICU admissions in San Francisco as compared to a place like New York. Where a lot of my friends that are working out there were just pummeled, and really putting it all on the line. We were really lucky that in San Francisco, things, at least at UCSF, things were manageable. Um, Again, manageable is a kind of a qualitative term, but all in all, it didn't look like we were going to get that same surge that was in New York here in San Francisco. Um, and if you had asked me a couple weeks ago, I would have said, I think we're going to get through this without um, our hospital systems being overrun. But I think all of that changed this past week, where friends and colleagues are saying, uh, either experiencing firsthand or anticipating a surge here in the Bay Area, because of this uptick in cases. Um, and I'm actually not working. I'm working more at the Children's Hospital now, which is a very different experience. And we're lucky that children seem to be overwhelmingly, um, have kind of fewer uh, negative outcomes compared to older adults, for example, or immunosuppressed folks.
Mhm.
But I was lucky enough to be a part of a group back in April and May of some medical students actually started this program to, um, help patients that were in hospitals connect with their families. And so one thing people didn't, we focus a lot on these hospitalizations due to COVID, but what we don't realize is there's still people getting sick with, diabetes and heart disease and, broken bones
Yeah,
and
sure.
infections and all the other things that hospitals normally care for. And those things are equally hard, even during a pandemic, but now compounded with the fact that although we didn't have a ton of cases in our hospitals with COVID, a month or two ago, we had no visitors allowed in the hospital. And that one thing actually had, I think, an enormous effect. And one of those is that as a patient, you may have a stroke at home, wake up in a hospital, surrounded by nobody you know, and not allowed to see anybody you know, because of that risk of infection, even if you were COVID negative. And so some medical students started an amazing program along with residents to go to the bedside and set up Zoom calls. So they did a tablet drive and set up calls between patients and loved ones, so that they could Zoom call their loved ones and just feel connected in some way. And it was an incredible program that I started volunteering with at the General Hospital in the Mission. And that's where I kind of got a lens into kind of what's going on behind the scenes in the hospitals. And while things were under control in terms of, um, you know, at that point, there was at least some level of COVID testing. We didn't have the ED wasn't overrun with COVID cases. You just had tons of patients really suffering without being able to see their loved ones. Um, and one thing we don't really realize is there's something therapeutic, right, about being about your family when you're sick. Some which we can quantify in terms of a patient that has a neurologic injury and seeing their family, helps stimulate parts of their brain that heal.
Hmm.
And then some things we can't really quantify. You know, you have a knee injury, and that motivation of being around your family allows you to want to get better faster, want to be more active, lift you out of that depression. And so honestly, that was hard to watch for me, and even, it was my first time back in the clinical space in about a year, and I was a little tenuous about it, and it was emotional. It was really hard to see, and providers having to work, already working intense hours, right? Burnout existed, as I've talked to you about, well before COVID, but now exacerbated because you have to stay 6 feet away from your coworkers, right? And you're so nervous and
Hmm.
you're so careful, um, and nervous about having to potentially go home. And I knew residents and professors who were isolating themselves from their children, from their parents, from their spouses. Um, that was incredibly tough to watch.
Yeah.
Um, yeah, and so I
Yeah. So
worry. I worry now.
yeah, that's probably one of the things that terrifies me the most is hearing the stories of people who are in the ICU and they're maybe getting intubated and they just can't see their family. Like they're maybe a FaceTime, but it's like thoughts of like, am I going to die alone? Like here overnight? Like that is like such a helpless feeling. I can't imagine feeling any more lonely than in that time. So that's a really cool program that you volunteered for. Um, so is like, are most of the patients when you were in the EDU um, COVID patients, or were they mostly kind of a smattering of different other ailments and diseases?
These were mostly non-COVID patients. So, uh, like here in San Francisco at that time, our admitted COVID patients, I want to say, wasn't more than I think maybe 40 or 50 at the time, um, which was peanuts compared to what was going on in New York.
Yeah,
Um,
and that's
and
like
and so
all of the
the,
hospitals. Is that like
that
all the
was
hospitals or just your
that was
hospital?
that was all the UCSF hospitals and the
Okay.
UCSF affiliated hospitals. From I'd have to double check, but yeah, about hospitalizations outside of those. But yeah, within the UCSF hospitals, it was, um, I want to say, no more than 50 at a time back in April and May.
Yeah, yeah, but the that's the story that people don't really think about is if you get any illness that you actually suffer from this pandemic in that way, by not being able to see people. Yeah.
Yeah, yeah, and we, I think So we were lucky enough to be able to isolate our COVID patients into floors where only certain people would go and certain people would be interacting with to reduce the risk of transmission. But another thing to note is at that time we didn't have testing. So we were testing people in the hospital for sure, at that time. But it is abhorrent how few people in the community we were able to test and how many people might have presented to the hospital, um, pretty late with some heart disease issue or some neurologic issue that might have been precipitated by COVID, but were never able to be tested
Mhm.
at whatever time, and delayed care. That's another thing that people didn't realize, that a lot of people that were coming into the hospital and still now are coming to the hospital are coming in with conditions that could have been more either preventable or more easily treated if they had presented early, like chest pain. We have tons of people that usually, you experience chest pain, you go to the emergency room, and if it is a heart attack, we can take care of it and hopefully get you home the next day. But now you have patients afraid of getting COVID, not coming to the hospital, experiencing chest pain for 2, 3, 4 days, coming to the hospital, and by that time, a whole portion of their heart has died, and we can't bring it back. So these are the kinds of things we don't initially think of when we think of the effect of the pandemic
Yeah.
um, in healthcare, but it has a huge impact.
Yeah, and that brings up sort of a pretty complex question, and I obviously I don't expect you to have the answer that uh, endorsed by everyone, all medical professionals. But I'm curious, like, given the rates of COVID in San Francisco, and balancing that with the risk of I have chest pain, or I have this issue. Um, at what point does it make sense for someone um, to say, like, we should allow people to, or I'm not even, it's not like they're not allowed, I guess it's more of a fear, but at what point should people say, like, it's riskier to not go to the ER right now for some ailment? um and, like, kind of related to that, like, is there, like, at what point is the policy of not allowing visitors in the ER and EDU, when is that, does that no longer make sense based on the emotional cost?
Those are great, great questions. I think they're questions that, yeah, that come up in a lot of people's minds. I think truthfully, I mean, and this is probably such a vanilla answer, but the truth is it's case by case, right? Like anything is in medicine. But the real answer to this is telehealth. I've actually been doing a lot of telehealth visits right now in the clinics that I'm at, working
Mm.
with, and they're definitely not my favorite. I definitely have some feelings about telehealth. It's incredibly frustrating. The Zoom connectivity issues, not being able to be face to face with a patient, not being able to do a physical exam are all huge detractors. But I can tell you, if someone's experiencing chest pain, the first thing they should be doing is setting up a virtual appointment, um, as soon as
Mm.
possible. I think presenting to the ER is necessary in certain situations, and definitely if you feel like, if you're experiencing extreme pain, if you are concerned about your livelihood, you should be going to the ER, regardless of what, whether COVID is there or not. Um, you know, but I do want, I think the idea is that it shouldn't be kind of a 0 to 100 where someone says either I do nothing or I go to the ER. There should always be this kind of intermediate option, which is let me do a virtual appointment. And this is why it's so critical for people to have access to a PCP or a primary care provider, because if you have a primary care provider, you can set up a virtual appointment with them, ideally the same day,
Mhm.
and just they can ask you a certain set of questions. And it's for chest pain, we have questions we ask. And if you start telling me, if you came to me on a virtual appointment and you said, hey, I'm having chest pain, and I say, okay, Peter, is it worse when you lie down? Is it worse after you eat spicy food? Did you drink a bottle of tequila last night? If you said yes, I'd say, well, it sounds like you have acid reflux.
Yes to all
But
those things.
exactly
How did you
right.
know?
Exactly. With all the things that I know that you do, every other day, I would
Yeah.
say, don't worry about the chest pain.
Yeah.
It's probably not a heart attack, and you should, and the risk of coming to the ER is greater than, the risk of having your acid reflux not treated. But if you did tell me it was crushing, if you did tell me you're out of breath, that you were passing out, I would say absolutely you need to come in right now. And so the reason that that's so important is it kind of links back to what we talked about earlier, where a lot of people don't have access to that. And I think COVID is exposing, I think people have said this well, where COVID is exposing the disparities in healthcare that have always existed. These are not new disparities. It should not be surprising to us that certain populations are being infected and dying more than others. That is not a surprise, sadly enough. I think it's only now becoming more commonplace to understand that for someone who doesn't have access to a healthcare provider, they're not going to be comfortable or able to have a virtual appointment. They're going to have to wait those 3 days, right? They're not going to get that clarity. Um,
Mhm.
and I think that's especially important for those of us that have the privilege of having that ability to do it, to take advantage of it, you know, so that you can, you know, uh, take care of yourself and your loved ones.
Yeah. Yeah. So I actually have a personal question, and I think that's probably a question on a lot of people's mind, which is um, like balancing your risk tolerance. Like I think everyone has a different risk tolerance while we're slowly opening up. Like some people maybe hanging out in groups, doing social distance hikes. Some people are like have a clique. Some people are not, like are still totally isolating, and it's something that I've kind of been struggling. It's almost like everyone has to figure out their own core like values, right, or core threshold. And I'm I would be interested in hearing about like what your personal threshold is and what your like fellow med students and people who are actually in the hospital, because I feel like you're in a unique position where you have more of the information and you have more of the you actually see things firsthand. So um, yeah, like how have you been thinking about your threshold and generally what have you been observing from others?
It's a great question, Peter, and I think it's a scary one. It's a scary one because I don't think there's a right answer to that. And I think with so much misinformation out there and a lot of people looking for kind of justification, for being a little bit looser with social distancing or mask wearing, I'm afraid to give any power to that. But I'll answer your question from a personal perspective. I can tell you that I know people in healthcare who are as extreme as you can get on most sides. I mean, in terms of there are people who literally never leave their house. They leave their house to get groceries once every 2 weeks. They wear a mask and they never even touch the mask. They're not hanging out with people. They're not doing any of those things. And to be honest, that is the safest you can be, both for yourself and for others. Um, but I think as we see that there's certain things that are where we know that there is a risk, but we're willing to take it. I think, at least for me, it has been a lot around mental illness. So for me, quarantine has been a trying time for my mental illness. I have depression, I have anxiety. Um, I at times can be very hyperactive, and honestly, being around people is what gives me strength and joy. I mean, it's why I came into medicine. My favorite thing in the world is to be in a group of 1,000 people, which is the absolute worst thing to do right now in the pandemic. So it's literally whenever I had a rough day, I would just like go sit in the middle of Dolores Park or just walk around and like see all the people out there and be so happy. Particularly getting out of the hospital where I was
Yeah.
incredibly burned out. And so for me, it's been a balance of mental this risk of the mental illness versus the risk of COVID. You know, and I think we should all be as safe as we can possibly tolerate. That's, I think, really the best answer I can give. So for me, when I feel myself becoming depressed um, and really craving that kind of that social experiences, um, I don't rush to be in a group of 1,000 people, but I definitely look for kind of who are the people in my bubble, right? So these are my roommates, whom I are already part of my bubble, right? My family members that I have been seeing that are
Mhm.
part of my bubble, and I really try to utilize them first, as much as I can. That way, I'm not increasing my risk in any way. right? But if I do feel like, you know what, I need to get outside, I need to go on a bike ride, um, then yeah, I go on a bike ride, and maybe I go on a bike ride with a friend where we're 6 feet apart. Biking is a great activity where you're usually pretty socially distanced. I still wear my mask when I bike. It's incredibly uncomfortable, for sure, but it is worth it. Um, and I think working in healthcare has given me that unique perspective because I think on this, a week ago, I started working on a unit um, for children that have rheumatological diseases, which are kind of usually a unique subset of autoimmune diseases. So a
Mhm.
lot of them are actually on immunosuppressive medications. And getting to talk to them and understand the risks that they take and their family take every day, right? So for their parents, they have to choose between going to work and making money to pay for the medications that their child needs, um, you know, which will inevitably increase their risk of contracting COVID, which if they give to their child on an immunosuppressive medication could put them in danger. And having to make those kinds of hard decisions is unfathomable. And I think for me, helps remind me that I'm not doing this, I'm not wearing a mask and social distancing just for myself. I'm doing it because if I can reduce that risk for that parent, even by 1%, then that family is going to have at least a little bit of an easier time.
Mhm.
Um, and I know that's really easy to forget when you're just like exhausted. Quarantine sucks. It just sucks. There's no other way of putting it.
Yeah.
Being away from your loved ones and
Yeah.
not getting to do all these great things. But I think that with that lens, and and being able to do what you can tolerate and finding creative ways um, to tolerate things, I think we'll be able to get through this.
Yeah. No, I really appreciate the honesty, and I think that is it is yeah, like anything that's there's no black and white, there's no right or wrong. Like every uh, I'm a big believer that feeling shame and feeling guilt is just not entirely productive. Are there any things that like in the healthcare community that you guys like wish people outside the healthcare community knew more about, or like are there any misconceptions as we're opening up, and like should people feel more secure, like more safe about certain things but more cautious about other things, like or is generally the public perception pretty on point right now?
I think the public has access to, I mean, pretty much the same information we do in the healthcare space. I hesitate to say we're kind of hoarding any or like kind of keeping any information. I think as I work on public health issues, what I've learned is so much of healthcare, and particularly important as pandemic, is trust. It's trust between healthcare workers, and not just healthcare workers, the healthcare system, right? Insurers, hospital systems, and the public.
Hmm.
And when that trust breaks down, right, we are suboptimal. And that trust breaks down in so many ways, right? When we talk about the anti-vaccination movement, um, right? When we talk about people not adhering to their medication regimens because they don't trust their physicians, you know, there are, not to say any of these things are right or wrong, but they are really outcomes of poor trust. And I think right now we're testing the trust of the public with healthcare. I think overwhelmingly the people who do wear masks, who do follow social distancing protocols, are people who trust the healthcare system. They say, you know what, I'm going to do my part, and I trust you all to do your part. And I think for people who feel like not wearing a mask and then not believing that there's a virus, a lot of that comes not out of hatred for others, right? I think that's not really the point here. The point is these are people who mistrust the healthcare system and science in general, and that's really scary. I think that's a huge problem. Um, I acknowledge that in healthcare we have done things to deserve a certain portion of that. In our past, if you dig into that, the history of medicine, there's all too many instances of really messed up stuff in terms of things like forced sterilization for inmates, testing in the black community, Tuskegee, um,
Yeah, even
And
practices like they bleeding, right? What was the Lancet? The medical journal is named after this tool that was used to bleed people out for fevers because they thought that was the way to go.
the humors of the body. And and I acknowledge that there are messed up things in our past, but I think what's tricky is that unfortunately that mistrust resulting in these kinds of um, unsafe activities and unsafe ideologies, conspiracy theories, are what creates, I think, are what could undermine our entire public health.
Mhm.
And I think if we can focus on kind of building up that trust in a way that is, um, it can't take years, right? I mean, people are dying, right? We can't wait 20 years for people to start vaccinating their kids. You know, it's unacceptable. But we do need to be aware of that in the back of our minds as we try to convince people that this is a real virus, this is a real disease, and it really hurts people, and that you can play a part. And as long as you do, we will too. Um, so I think that's kind of what I want the public to know. The other thing and this is just because this is a little bit of my stump speech. As you know, I care deeply about the burnout of healthcare workers. I dedicated this last year to understanding burnout of medical students as well as residents and physicians. Um, and during COVID, this problem has only gotten much worse. The sacrifices that healthcare workers make, that I'm very grateful that people are starting to pay attention a little bit more in the era of COVID, and people have been so grateful, um, and that's amazing. But unfortunately, that gratitude alone, I think, is not going to help healthcare trainees survive this. It's not going to help get the hazard pay that residents need. It's not going to protect physicians from being fired for talking about a lack of PPE. It's not going to help medical students with disabilities that are told that they can't advance into medical training because there's no possible way that they can finish the surgical training if they use a wheelchair. These things that I think the healthcare system has to be a reflection of us, and we have to demand better of it. And I think one way to do that is to advocate for resources for our healthcare workers, not just for the healthcare system, right? Because so many of those resources are taken away by people who have an interest in profits or liability protections for pharmaceutical companies. We really need to invest in healthcare workers themselves. How do we protect them? How do we support them? How do we let them do the job that they were trained to do, while also holding them accountable, right? For those that take advantage of it. Um, but I think the more that my hope is that out of this pandemic we can raise some awareness about that translates into some real policy change. Because I know that we'll get through this. It'll be hard, but we will get through this. I just want to make sure that nothing like this ever happens again. And for that, we're going to have to do some really tough digging.
Yeah, yeah, and for folks listening who want to learn and help out with this cause of reducing healthcare burnout, do you have any resources or recommendations? Like, how can they help?
Yeah, absolutely. I mean, get in touch with me. I'd love to talk to anyone about it. Um, but I really think um, oftentimes the biggest things are going to be with who you vote for, right? And I think that connects to a lot of what we're talking about now in terms of racial justice, um, and so many other issues that are going on in the world. Is that you know, we have so much power that in the way that we can vote. And for healthcare burnout, you wouldn't think that you could change it with a vote, but there are actually bills out there that really affect the residents that are working on the front lines. There are hospitals right now that are cutting pay for their residents in the face of the economic recession, which is just horrible to think about. And that is largely because federal and state funding for residencies actually come from things like Medicare and Medicaid. And so, as voters, we can choose to support bills that increase the pot of money that we put towards paying residents. Right? In a way, residents are all state and federal employees to some degree. And if you want to support that, if you think that's important, um, that's really valuable. But I think overwhelmingly, it's the biggest help you can do for a healthcare worker is to take charge of your healthcare. Get a primary care provider, even if you feel okay. Stay connected. That way, when you need it, you can utilize it quickly and not wait till things are so far that it's hard to fix. But I think ultimately, also, at least when it comes to moral injury, the best thing you can do for um, healthcare burnout is support a social safety net. We need to have housing. We need to have affordable access to healthcare and health insurance for every single person um, in this country. Otherwise, there's no way the healthcare system will be able to take care of these people. So hopefully, if that can influence you, that'll be a win.
Yeah. Awesome. Well, how can folks get in touch with you? What's the best way if they want to talk more?
Email me. I really need to get better at this whole social media thing. I have a Twitter and I just it's like I think I have like 10 followers and I never tweet. So I feel like I should probably start doing that. But I think emailing me is probably great. It's like first name dot last name at ucsf.edu. I can give it to you and you could maybe
Cool.
put
I'll
it in
put
the
it in the show notes and add
little
in a
info.
little fuzz to avoid the
Yeah,
scrapers and stuff like that.
yeah, for sure. But I always love talking about any of this stuff and learning from people. Um, and yeah,
Cool. And I'll definitely, I know we didn't have time to talk much about the burnout stuff, but I'll definitely link to the episode that you did with UCSF folks because I think you covered a lot of stuff there. But yeah, I really appreciate your time, Nikhil. This was super fun and informative, and it's good to see you. And
yeah,
love to
thanks,
catch up.
Peter. Yeah, it's always great, and I'm very honored by being chosen for this. I always see your podcasts and all the cool people, and I'm just like, when you messaged me, I was like, Peter, I'm not that cool, right? Like, I think, like, I appreciate you picking me as the ambassador for all this, but like, I'm not. I'm just another med student. Like, I can refer you to 10 other people that have way more interesting
No,
perspectives on this. But
no. I mean, you're a very interesting person. I think. I mean, honestly, this whole podcast is like, it's kind of an excuse for me to just talk to people I want to talk to and I find interesting and my friends and you're one of those people. So I've always looked up to you and kind of been curious what you've been up to. So now the whole world can share in on that. So
thanks, man. I appreciate it. And hopefully, when this is all over, we will rejoice. We'll do a nice little stroll through Dolores
yeah, we'll hang out
once
with
it's all
a group
over.
of 1,000 people together.
Exactly. I would love it. I would
Yeah.
love it.